This is On Point. I'm Meghna Chakrabarty, and today we are taking a close look at the state of Mississippi, currently in the grips of a terrible surge in the COVID pandemic. According to reporting from one of our guests, Nick Juden, who's with the Mississippi Free Press, last Friday, Mississippi announced more than 5,000 new COVID cases in one day. That was the third record-breaking day in a row, and leaving, in Nick's words, the 3,000 case day as a relic of the dramatic winter surge that happened before the vaccine. So smashing those numbers in terms of new COVID cases in the state of Mississippi. So as I said, Nick Juden joins us today. He's with the Mississippi Free Press. We're also joined by Dr. Luann Woodward, Vice Chancellor at the University of Mississippi Medical Center. And Dr. Woodward, you had mentioned what the toll that this terrible surge right now is taking on healthcare workers themselves. So if you and Nick could just stand by here for a moment, I want to turn to Alex Cobb, who joins us from Ocean Springs, Mississippi. She's an ICU nurse in the COVID ward at Singing River Hospital. Alex, thank you for taking some time to join us today.
Hi, Meghna. Thank you for having me.
So what's going on in the COVID ward at Singing River Hospital?
Man, so we are just seeing younger and younger patients that decline more rapidly. Right now, in the ward I'm in, we have 12 beds, 11 are ventilated patients. These are not all super unhealthy, morbidly obese people. Some of these are fairly healthy with few or no existing medical conditions, and that's the really scary part.
And when you say younger and younger, what age ranges are we talking about?
19 is the youngest we have right now.
Okay, and that's really different from last year.
Oh, yeah. 19, a couple 20s. A good bit of 30s. I mean, these are young people.
So how have you been doing?
I mean, taking it day by day. That's really all you can do. These people, once they go on the ventilator, we can guarantee they are going to be on that ventilator for at least a week, and they may not come off. So we take it day by day.
Okay. And, well, I mean, one of the big differences, in fact, I'd say the biggest in terms of public health differences between now and previous surges is that there is a vaccine. Are
Right.
any of your patients or their family members, I mean, as you well know, let me back up here a little. As you well know, the head of the CDC, Dr. Rachel Walensky, said a while ago that this is now a pandemic amongst the unvaccinated. Is that what you're seeing in your ICU?
Absolutely. Each and every ventilated patient we have is unvaccinated.
Okay. And are they or their families now saying that they had wished they had been vaccinated?
100%. I've spoken with several families now who have since gotten their vaccinations. And a lot of them beforehand say, they were getting to it. They wanted to get vaccinated, but they had all this other stuff going on and they just didn't make it in time. So we are seeing a lot of that too.
And how do you feel about that?
I'm glad that people are kind of starting to see the light in getting vaccinated, but I'm also frustrated because there is such a large amount of our population that still doesn't believe that it's real. They have their theories of things such as it's a zombie apocalypse vaccine and it isn't real. So I have some frustration, but also, I think that if we can spread the word and make people realize that this is a real virus affecting real people, that these aren't just numbers broadcasted on the news, these are real life events, then maybe we can get those vaccinated numbers up.
Okay. So here's what I'd like to ask you to do, Alex, if you could. I think In hearing you say that once people end up in the ICU, they wish they had been vaccinated, maybe we can convince some people now that the thing to do is to never have to show up in the ICU. And I think human beings respond very powerfully to detail and visceral explanation about what happens to them when they get sick enough to get ventilated. So do you mind taking a minute to describe to us what exactly the procedure is to put someone, put a tube down their throat to help them breathe, to ventilate them? What is that actually like? And what does it do to the patient?
Well, well, first of all, there's a tube down your throat. We sedate you and paralyze you to get that tube down. And then we put you on a machine that controls how much volume, how much oxygen you're getting. And we have to try to keep you sedated while you're on the ventilator. And a lot of times it's just natural for patients to fight the ventilator. So we have to put them on a lot of sedation. And then once patients become ready, we can attempt breathe-in trials. To do breathe-in trials, we have to wake those patients up. So these patients have to wake up. They're in a fog. They don't know where they are. They don't know what's going on, to try to breathe on their own. And then if they fail their breathe-in trial, we put them back to sleep. Try again. It's like a daily thing, daily breathing trials. And eventually, after 2 to 3 weeks on the ventilator, if they can't come off, then we're talking to their family about a trach and a peg. So a trach in your throat, a peg is a feeding tube. So we're talking to family about that. If we can even get their vent settings weaned to come to that point. And then there's other complications that come with being on a ventilator. With COVID, we see a lot of blood clots. We see strokes. So being on the ventilator is one thing, but there's a lot of complications that play into effect that as well.
And do you mind if I just jump in here? And with those breathing trials, are you taking the tube fully out and letting people try to breathe on their own? Oh, no. Okay. So the tube's still in?
The tube is still in. We cannot take that tube out until we can guarantee that patient is going to somewhat be able to breathe on their own. Most of the time, if we're able to take the tube out, they have to go on BiPAP. But no, we do not take the tube out for a breathing trial. For the patient, it's hard because during a breathing trial, we have to wake them up, meaning turn the sedation way down or off. So the patient actually does wake up and they have a tube down their throat. So people need to understand that. I mean, we can't keep a patient fully sedated and expect them to breathe on their own through a tiny tube going down their throat.
I've read that patients feel during these breathing trials when they come off the sedation, because the tube is down their throat, that it's almost like they're being choked or suffocated, even as you're trying to test their ability to breathe.
Absolutely. They are extremely anxious and it's very uncomfortable. And I think that people need to understand that that's part of the process. And if they get vaccinated, maybe they won't have to go through that.
Right. So there's one simple act to take that can avoid that terrible pain and long suffering that comes with having to go on a ventilator if you end up in an ICU. Thank you for that description, Alex. Really, I just think people need to know. Do you mind if I ask? I mean, you've seen multiple waves of this, and your fellow nurses as well. What's the sort of the mental health state of the nursing staff there? And you heard Dr. Woodward a little earlier say that people have been leaving the profession, or at least leaving the state because it's just getting too hard. I mean, what have you seen?
I have seen a lot of frustration because it does not have to be this way. They do not have, if they were to get vaccinated, they would not have to get to a point of needing ICU level care. They could, possibly still get sick, but they might not have to require this level of care. But also, a lot of people are just sad. it's so sad to have to call the mom of a 24-year-old and have these conversations about ventilating their child, or, call a 19-year-old and he's the only decision maker for his father and ask what he thinks about intubation and life support. So it's just, everyone is sad right now, just frustrated and sad.
How many nurses, when this pandemic started versus now, how many nurses that you've been working with are still there at the Singing River Hospital?
In the COVID unit, there are 2 full-time nurses left at this time that were still there. Most have gone off and taken other positions. A couple have gone to just totally gotten out of critical care and they're still in nursing, but they've gone to places such as the OR or the clinics.
How much longer do you think you can hold up being a nurse in the COVID?
I mean, I'm gonna hold out as long as I can. I have young children, so I'm of course worried about my children. I'm really hoping that we can all come together and get vaccinated, because I'm really concerned about future variants coming out. So I'm going to hold out as long as I can until, my own, I don't know.
Yeah. Well, Alex Cobb. Yeah. I appreciate your candor, though. I mean, I think not knowing is one of the biggest challenges right now. But Alex Cobb, ICU nurse at Singing River Hospital in Ocean Springs, Mississippi. Thank you for all the work you're doing trying to save lives, and thank you for joining us.
Thank you for having me.
Well, Nick Juden and Dr. Luann Woodward, I appreciate you listening along with us to what Alex is experiencing there in the hospital. Dr. Woodward, let me just briefly ask you, she was talking about the younger and younger patients there. Is that what you've been witnessing at the University of Mississippi Medical Center too?
Absolutely. And the one thing that I would add to Alex's experience of being with those patients as they become more and more critically ill, that I know she has experienced, all of the nurses and physicians have, is when the patient comes to that realization that they're not able to breathe on their own and maintain, many times they're unable at that point to speak, but the look in their eyes, there is absolute fear and panic when you're talking to them and you're explaining, we are going to have to put you on a ventilator, we are going to have to intubate you and put a breathing tube down your throat. The patients that are able to hear what you're saying, it is a sense of panic and just fear in their eyes, because even at that point when they may not be completely mentating at their full capacity, there is something they understand that they may not come off that vent, and that is just it is blood chilling. But we are, just as she described, we are seeing younger patients. Out of the 141 that we have admitted in our hospital today, 22 are pediatrics. This is our all-time high. In earlier surges with this virus, we just had a handful of pediatric patients. But now, in fact, we are seeing younger patients. We are seeing younger adults. Honestly, exactly what she described. These are young people. They are in many cases previously healthy. This is unlike our experience with the Alpha variant. They are many times previously healthy. The runway between being positive, testing positive, getting the virus and testing positive, and needing to be hospitalized has been shortened. So the course is more rapid. There is really nobody out there, based on age or baseline health status or any other variable, that should feel that they can evade this virus. We are seeing it hit everybody, all ages, all health status. It is extremely contagious, and this is very different than what we saw before.